Welcome to my channel, Medical Assistant with Miss K. My name is Kendra. I am also known by my students as well as my community as Miss K. And just to give you guys a little bit about myself, I have been a medical assistant and instructor since 2011, but I became a medical assistant in 2004. So in this video, I want to talk about becoming a medical assistant instructor. Now, I have other videos on this channel about that same topic on becoming a medical assistant instructor, some tips and advice on it. And I will make sure that playlist is linked at the end of this video. So if you want to check out those other videos, you can. But I want to talk about this because this is one of the most common questions that I get, like how to become a medical assistant instructor, how do I qualify, how do I know I'm ready? So I want to talk a little bit about that in this video. And I do want to let you guys know, I do have a resource for new medical assistant instructors. I will link it below the video and also in the comments. It is just some templates for you guys. It is, when you first become a medical assistant instructor, there's just some things you're going to need, some templates. So I have some templates in there, just ways to introduce yourself on the first day, some icebreakers you can do, some fun ways, of learning, because with adults, you got to keep their attention. Also, I have a clinical checkoff sheet in there. Now, your school may give you a lot of this, but this is for anybody who wants to maybe get a head start, or maybe your school does not give you many resources. Now, I've worked at several medical assistant schools, and I already know how it is. Like, some schools that will give you everything you need, but then you have some schools that will kind of just throw you out there, put you in the classroom and like, listen, teach. So make sure you guys check that out. But anyway, let's get into it. So I got a question in my group. It was either in my group or on my Facebook page. I can't remember, but somebody wanted to know, how do I qualify to teach medical assistant? And what I told her and what I tell everybody else, medical assistant programs, they want you to first have experience. So that is the first way you qualify to be a medical assistant instructor. You have to have experience. If you're a medical assistant and you want to teach, this is something you've been thinking about, something you're interested in, you will need to call around to some schools in your area to see what their criteria is for their instructors, okay? Because they're going to want you to have experience, but how much just depends on the school. So some may say at least 3 years, some may say at least 5 or more. So it just depends. So that's one of the ways, it just depends on your experience, but you really won't know until you call around to the school. So for anybody that's interested in becoming a medical assistant and instructor, just start by looking up MA programs in your area and then, making a list, writing down the phone numbers or whatever, and then calling around to those schools to see what their criteria is. Okay. So the experience is one thing. And then also most schools are going to also want you to be certified. So are you a certified medical assistant? Now, if you're somebody maybe watching as you're RN or you're a provider, your experience and your credentials will allow you to automatically qualify to teach medical assistant, obviously, because your scope is bigger than a medical assistant. So, just wanted to put that out there just in case I had any nurses or providers watching my channel. And then some other qualifications I'm going to talk about is, qualifications that have to do with you. As medical assistant instructors, one of the things that we quickly realize when you first become a new instructor is that it is different teaching. Teaching is different from actually doing the job, because anybody, if you've been in the field for a while, you know how to show up to work and do your job. You know how to draw blood. You know how to check blood pressure. You know how to give injections, but it's a different thing when you have to teach. So if you're someone who wants to know, like, am I someone who can teach? You have to ask yourself, like, do I have enough patience to teach somebody a skill who has never done it before? Like, some people have never held a needle in their hands, right? Blood pressure, that's one of the most difficult, one of the most challenging skills to learn. Do I have the patience to explain to a student how to read the sphygmomanometer? Like, do I have the patience to, teach a student how to draw blood for the first time, how to do an EKG? So that's one of the things you want to think about. And only you as a medical assistant, being in this field, you have to have patience. You have to have patience for your patients. But when you're an instructor, it's a different thing, because these students, they're learning. Some of them, like I said, have never even held any of these things in their hand. So you're really teaching, even when it comes like the medical terminology, it's like learning a whole new language. Think about when you first learned. So you want to kind of look at yourself and ask yourself, do I really have the patience to actually teach? And speaking of being able to teach, that is one of the things that you may have to do when it comes to obtaining a medical assistant instructor role. So the program, a part of your interviewing process, they're going to want to know that you can teach, because again, just because you can do the job does not necessarily mean you can teach it. So I usually just recommend having something prepared. If they give you the choice and they tell you just choose any topic or choose any body system, I always say just choose your favorite body system and pick maybe about 5 structures from that system and then the functions of it and go over that. And then of course a few diseases and disorders, maybe about 5 diseases and disorders of that system, and then be able to present that. And I always say just make it interactive and fun. You always, when you go into the teaching demo, you want to go in there and ask a question. Like my teaching demo, I'll never forget when I very first started teaching, it was on the blood system. And so I went in there, I had my little handouts. I printed out some diagrams of the blood and all of that. But before I did that, I said, hey, who knows what blood is? Do you think that's just a red substance or a red liquid running throughout your body? I just made it funny. And so just think about ways that you can start off with the question, have some handouts to give out. And also you can always look at some videos as well. That I'm big on videos, very big on videos. And speaking of videos, that's definitely one thing that you're going to want to incorporate as a medical assistant instructor when you're in the classroom, because as adults, listen, let me tell you guys something. We say kids have low attention span, but actually adults have a low attention span, because think about it. You're an adult, you have bills, you probably have children, you have things going on. So these are things that's going to be on the mind of your students. That's just what it is, And so as an adult learner, you have to, when you're teaching adults, you got to keep their attention. So short videos, I would say, and that's something that I do talk about in a resource that I mentioned earlier, but using videos, using games, even involving the students, having them even, teach certain lessons and stuff like that. That's ways to keep them involved. But I wanted to, just mention that because I was talking about videos, because just like videos are going to help you, videos are going to also help your students too. So you want to be able to incorporate that as well. And just again, as I mentioned, remember that adults have a short attention span, and also know that everybody learns different. Now, another thing that you're going to have to do, because many of you probably have been out of school for a long time, you are going to have to study the material. So you're going to have to study what you teach. It's just the reality of it. If you've been out of school for a while, most likely you've forgotten a lot of things. So if you do, once you have gone through the process of, looking for schools, becoming a medical assistant instructor, you got the position, the first thing I always say is to get the textbook, the workbook, whatever it is, whatever material your students are going to have, and you want to go through it yourself. Now, of course, it's going to be a big book. You won't be able to go through it all at one time, but at least make sure you are going over each chapter before you actually go and teach it. Okay. So before class even starts, before you are even going in there to teach, you should have gone through that chapter, the workbook, any assignments that are associated with that chapter. You should have gone over all of that. And I mentioned earlier that, most schools are going to want you to be certified. There may be some schools who maybe will, allow you to teach just based on your experience. In that case, I do recommend getting certified. So if you are hired and your school, accepts your experience, maybe they give you time to get certified, maybe not, I'm not sure. But I do recommend you taking the exam, especially the exam that your school is offering, if you are eligible. So this way, when you're going over the study materials with your students, you're already familiar with it. And if you are already certified and your school offers a different certification than what you're taking, I don't necessarily think that you need to go and take that certification. I think it's a good idea if you do, but at least make sure you are becoming familiar with the study materials. So that way, when it comes time to go over with your students, you're already familiar. You're able to answer certain questions. And the biggest thing is going to be preparation. At the beginning of your class, and when I say the beginning of your class, I mean at the beginning of the course, like before the course even starts, this is where you want to do all of your hard work. Don't try to wing it. Don't go day by day trying to decide, okay, what am I going to do tomorrow? No. Spend your time at the beginning of your course to figure out what you're going to do, okay? Even if you got to go week by week. So the way I would do things at the beginning of the course, so the last program I taught for, it was 12 weeks, and I broke mine down into, I broke it down week by week. So week 1, week 2, and so on and so forth. And each week they were broken down into the assignments for that week, the chapters that we were going to go over, any quizzes or tests that was going to happen that week. when you break it down week by week, it makes it so much easier. I'm telling you, the biggest thing is going to be being organized. If you're not organized, you're going to feel overwhelmed. And, if you're trying to figure out what am I going to do tomorrow, it's because you are unorganized and you are going to overwhelm yourself. And I do not recommend that. I did that when I was early on. I did that early on in my teaching career, and I do not recommend it because there's going to be moments where you're literally going to be sitting trying to figure out what are we going to do next. But if you already know in advance, you don't have to necessarily plan out the entire course. Now, if you have a computer system, a learning system like what is it? I can't even think of the abbreviation for it now. But if you have a computer system like Canvas or Blackboard, the good thing about those platforms is that you are able to copy from one course to another. The way the schools are set up, it just kind of depends. So let's say you work at a school where things change, every single month. You get a new class every month, but you're teaching the same thing. So you're the phlebotomy instructor. So every month or every 6 weeks or however long your modules are, you get a new class and you're the phlebotomy instructor. The good thing is that you can copy everything you did in that course. You can copy to the next month, and then you will just have to reset the dates and all of that, unless you have the settings where, the dates will automatically shift forward. So that's the good thing about it. Or even if you teach a class like the last program I taught for, where I had the entire, I had the same class for the entire 12 weeks. Even then, once that class is over, you can copy everything from that class to the next class. That way you have all of your you have everything set up. And then the biggest thing you have to do is just, again, change the dates, update anything you need to, take things out. As you teach, the more experience you get, you will learn your own flow. Okay. Because when I have trained new instructors, I've taught them my way, but after a while you get your own flow. Just like when I was taught, the person who trained me, they taught me their way, and then I got my own flow, because you will start learning some things don't work for you, and that's just what it is. And then you will start realizing some things that work for you. And then you'll start sharing other things with other, even more experienced instructors, because we're all learning every single day. So, like I said, as you get experience, you'll learn what works for you and what doesn't. But that's going to be non-negotiable, though. Taking the time in the beginning, doing all of the hard work, so that way the rest of the course can go smoothly. Again, even if you got to go week by week, that's fine. But just do not, whatever you do not go day by day. At least know this upcoming week, that first week of class, at least know what you're going to do for that first week. So if you can't do the entire course, at least know that first week what you're going to do. So like I said, I have a resource for you guys. It's the new MA instructor bundle. Just some ways to help you get started. Some things to say on the first day of class, some icebreakers you can do. Also, I had forms in there that you can get the students to sign if you had to do some remediation with their skills, if you had to give them a verbal warning, if you had to send an email to them. I have some templates in there for that. And again, these are things that your school may give you, but then again, they may or may not. So that is there. And I'm pretty sure I'm leaving some things off. This video is not scripted. I'm literally just talking off, the top of my head. So I'm pretty sure I'm leaving some stuff out. If I think of anything else, I'll do another video. I do plan on doing some video lessons just for new instructors, and I'm going to turn that into a bundle as well, just on different topics. It won't be on this channel, but it'll be something separate, like this bundle that I'm speaking of now that's going to be linked below. So hopefully this video was helpful. Chime in below. Let me know if you're thinking about becoming an MA instructor, or if you're already an instructor, how are things going for you? How long have you been an instructor? If you're new, let me know how things are going for you. And also offer any tips in the chat, in the comment section, if you can, for any new instructors, if you're seasoned. That will be very helpful to them. So thank you for visiting my channel. If you haven't already, make sure you like the video if you enjoyed it. And also make sure you subscribe if you haven't already. Thank you again. Be blessed.